Hello, my name is Joyce Gibb. Thank you so much for being with me today. And this is part 2 of a 2-part series of diverticulitis. And this information is from Gastroenterology 2019, 156 by Straight and Morris, who are the authors of this. So first of all, with diverticulitis, the pathophysiology, or how it gets to this disease state, is not completely understood. So they're still evaluating what that is. But they feel there's 2 main reasons that causes this disease state called diverticulitis. And the first is chronic inflammation. So, and there's several studies that correlate that, chronic inflammation definitely contributes to the pathophysiology. What causes chronic inflammation? And these are also risk factors of this: obesity, inactivity, the Western diet, cardiovascular disease, and diabetes all stem from inflammation. So that's pretty well documented that inflammation, chronic inflammation, contributes to this. The next part is the altered microbiome, or the amount, the good bacteria, the bacteria in your gut, and that's been altered somehow. And that usually happens with inflammation. That's another thing. And we talked about inflammation as being one of the causes. So, and then there's micro and macro perforations in the wall of the gut, and that can also contribute to abscess formation and infections. So the bacteria, the commensal bacteria, the bacteria that's supposed to be there, are out of balance. And the Western diet contributes to less diversity, or the different families of bacteria, where a good high fiber diet actually contributes to increased diversity of the microbiome and the good bacteria that are there. They also feel there's alterations in the colonic neuromusculature, so the muscles and the nerve endings that actually make the colon propel the food forward. That is impaired somehow. And usually the diverticulitis, which is the outpouching, occurs in the sigmoid colon, which is the part of the colon right before the rectum, and that is less distensible. There's no, when you look at the rectum, it's not distensible at all, but right before that is where the stool is actually stored, and that is very distensible. So you see, and I really feel like, chronic constipation, and where that colon is just, packed with stool, that wall actually gets weak at some point. This just makes sense to me, and that causes the outpouching. It just looks at functionally, that may be what's happening. So what is treatment? The initial treatment used to be antibiotics, low residue, low fiber diet, and pain control, and those were the mainstays of treating diverticulitis. Surgical resection after more than one occurrence in a year was another mainstay, because they just took that part of the colon out that looked bad, and hopefully the outpouching, they take that away, and then there'd be less reoccurrence. But now with that treatment really was largely based on dogma and expert opinion rather than data. So there has been, researches on what do we do with patients with diverticulitis. And, that's an inflammatory process. Associated disease has sparked new interest in the medical and surgical interventions of what to do about diverticulitis. So there were 2 randomized controlled trials, large trials, and they were also observational studies that challenged the need for antibiotic use for uncomplicated patients had uncomplicated diverticulitis. And each study found that antibiotics did not hasten recovery or prevent subsequent surgery or complications. So they're like, there's a growing interest in, not using antibiotics because of the resistance that happens with that. And then the European studies showed that, their guidelines, they stopped recommending any antibiotics for uncomplicated diverticulitis. But here in the United States, the Gastroenterological Association's 2015 guidelines recommended only selective rather than routine use of antibiotics. So unfortunately, what are some things that we can do that we have control over to not get diverticulitis in the first place? And I really feel like, diet's priority. Food is medicine, live whole foods, eat the colors of the rainbow, all those different types of things actually help increase fiber, increase the diversity of the microbiome that's supposed to be in your gut. That reduces inflammation. But unfortunately, right now, there are few data to guide the dietary recommendations, and then pain management too, because as you know, opioids actually can contribute to worsening the complications of complicated diverticulitis. But there is a multi-center trial that's underway looking at an unrestricted diet, which whatever you want to eat, versus a progressive diet. And their progressive diet really, starts with, after diverticulitis, like usually a liquid diet, then a low fiber, then a higher fiber progressing diet. So that, at least that's underway. They're looking at that to see what the results are of that. But one of the treatments that's been used for a while and that has shown to prevent the rate of reoccurrence is mesalamine. Mesalamine actually led to a faster recovery, but the rate of recurrence there's no change in the rate of reoccurrence of getting that. But mesalamine actually makes you recover faster. That's a non-steroidal old drug that was used for many, many years. So what happens if you have a small abscess, which is considered a complication? In diverticulitis, they usually do bowel rest, which means nothing by mouth, antibiotics, and if appropriate, they put a little percutaneous drain in there to drain off the abscess. So, this disease is still, ongoing as far as what the treatment should be, what's the guidelines for the treatment for it now. But undocumented, they don't really want to do anything if it's not documented by clinical trials. So one of the complications of diverticulitis, they just show that that's still under investigation, what you should be doing. So one of the things after the guidelines, they feel like you should have a colonoscopy 4 to 8 weeks after you're completely recovered from the actual treatment of diverticulitis. So, and then future directions shows that the medical community, they feel they have a lot to learn as to what to do next. Younger persons are getting diverticulitis now too. And one of the mainstays to prevent recurrence is the use of Xifaxan, which is a non-absorbable antibiotic, and mesalamine, which is the old anti-inflammatory. They feel that really will help reoccurrence. So what do we need to do? Larger studies are needed to try to figure out exactly what we should do, but for prevention, it's the things that we do have control over. High fiber diet. The Institute for Functional Medicine recommends 9 to 12, 1/2 cup servings of vegetables and fruit per day, and eat the colors of the rainbow. And that's a lot of fiber if you're used to only even having one serving, which is 1/2 cup. So you have to increase that gradually and not just slam your colon with a whole bunch of fiber, because you will have complications as far as gas and potentially diarrhea, etc. You should eat the colors of the rainbow. You should have digestive enzymes to help break your food down. You should decrease your weight. You should exercise. You should stop smoking. You should make sure your vitamin D level is 50 to 80. And then also consider probiotics, because that was used in one of the clinical trials to help prevent recurrence of diverticular disease. So I'd love to help you if you have any concerns about your friend or your family, yourself with diverticular disease and what to do about this. And come see me, and I'd love to help you on your journey to good health. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.